in the setting of a cesarean birth, the JADA is certainly an option and something we can use in the setting of treating a postpartum hemorrhage, but I think thinking through how we use it or may use it is really important. The first thing we need to remember is that the device should always be placed vaginally. So at the time of cesarean, we would always close the hysterotomy or the incision on the uterus. I think if there is ongoing bleeding, we would use things like our medications that the patient is eligible for. We can also massage the uterus and do some of our typical steps. But if bleeding is ongoing and the cervix is at least 3 centimeters dilated, we can actually have someone go beneath the drapes and place a JADA vaginally. You can do that while the abdomen is still open, and it's actually a nice thing to be able to see the device working in real time. As somebody places it from below and initiates that low-level vacuum, you can actually watch the uterus contract from above. It can be any obstetric clinician who can place it. So I think who places it may depend on your organization, your team, your institution, and what resources you have. If you needed to, as the surgeon, you could step from the surgical side of the bed, go below, and then come back from above with appropriate sterile technique. But again, who it is on your unit, whether you have PAs or midwives or nurse practitioners or residents, I think it just depends on your organization.